We understand how important it is to find the best possible healthcare for your child, and we thank you for trusting us. We also understand you may feel nervous, anxious, or even frightened by the thought of your child receiving anesthesia. This short video will give you important information about what to expect before, during, and after anesthesia. We want you to feel prepared and comfortable as you support your child through his or her surgery or procedure. Please feel free to ask questions or discuss your concerns with our doctors or staff at any time. Many parents wonder exactly how their child will receive anesthesia. Most children will initially receive anesthesia by breathing a combination of nitrous oxide and oxygen through a mask. Once your child is mildly sedated, they will receive an intravenous line, also known as an IV, through which they will receive fluids and additional anesthetic medications. Our staff will communicate with you through the entire process and keep you informed as to how your child is doing, when they're done with surgery, and when they're moving to recovery. Once your child is in recovery, and depending on your child, it should be about 10 to 15 minutes until one of our surgical staff comes to get you from the front. You will be brought back to recovery and be reunited with your child. Due to limited space and the privacy of other patients, only one parent or legal guardian is allowed in the recovery area. Please note that cameras and videos are always prohibited in recovery. Every child wakes up from anesthesia differently. Some wake up quickly, others are slower. Both are fine and totally normal. How quickly children wake up is often affected by the length of the surgery and the types of medications used. It's not uncommon for children to wake up feeling disoriented. Your child may cry and be restless. Their eyes may be open, but he or she may not be fully awake. This type of restlessness is very common and does not always mean your child is experiencing pain. In fact, most children don't even remember this transition period. If your child wakes up upset, it will most likely require several more minutes for the anesthesia to wear off. And as the anesthesia wears off, children usually begin to relax. Our staff will be carefully watching your child and continually assessing his or her progress and letting you know what's happening. We sincerely appreciate and value the trust you've placed in us by allowing us to care for your child. Our goal is to provide them with the highest level of surgical care in a compassionate and safe environment. Thank you for watching this video. We'll see you soon.